Anikanawea, hello everyone. Welcome to today's webinar series on cannabis and mental health, hosted in partnership with the Mental Health Commission of Canada and the Canadian Centre for Substance Use and Addiction. This is a three-part series. The focus on today's webinar is Indigenous-Led research, experience of cannabis and mental health. Anibojo nimkins Indigenous cause okikendan donjaba benishin dondem anishnabinindao. My name is Connor Lafortune, and I'm from Dokis First Nation, which is in northeastern Ontario. I'm on the MHCC Youth Council, and I work for Thunderbird Partnership Foundations, as well as various others cannabis-related organizations. I pass it now to Uba.
Hello, everyone. My name is Uba Mohamoud, and I'm also a member of the Youth Council. And I also work as a counseling therapist, focused on supporting immigrants, newcomers, and refugees. I am situated on Treaty 6 territory, also known as Edmonton, and I welcome you all here today.
So before we begin, we would like to acknowledge that the MHCC and the CCSA are both located in Ottawa on the unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. As those who are participating today are located across Turtle Island, we have invited the participants to acknowledge the territory you're joining us from in today's chat box. I'm currently on the Robinson Huron territory of 1850. I would like to remind everyone on Turtle Island that you're all treaty people and you all have responsibilities to your treaties and the surrounding Indigenous people. Uba will now give us some technical details.
Thanks, Connor. So all the research presented today was made possible through the community-based research grants at the MHCC and the Closing the Gaps initiative at CCSA, with funds provided by Health Canada in support of cannabis research. We are pleased to be offering this webinar in both languages. Today's webinar will be presented in English with simultaneous interpretation into French. To listen in French, click on the interpretation button at the bottom of your screen and select French as your preferred language. Please note that live captioning will also be available in French and English.
The slides are also available for viewing in French and English. Note, we'll watch a short little tutorial right now to help you get set up. You should see that both an English and a French version of the presentation side by side on your screen right now. The French will likely look a little bit smaller and be the furthest to the right. You can resize how you can view the presentation by hovering over the vertical lines that separate the French and English versions. Pull the vertical lines slowly across the screen until the presentation are viewable in a way that works best for you. You'll be able to see a copy of both presentations advancing at the same time through the webinar. You will hear from 4 research teams today, sharing the preliminary findings of their work. There will be a brief Q&A period at the end of each presentation and then again at the very end if the time permits. Feel free to type in any questions for the presentation in the Q&A box.
If you run into any technical difficulties, please use the chat box and our facilitator will help you out. Also note that a recording of the webinar will be posted to the MHCC's website sometime in March, so please stay tuned for that. Now moving into team presentations.
With all the housekeeping out of the way, we'll turn it over to the first team to get us started. Please help me in welcoming Alana, Roscoe and Magnolia, Perron from First Nation Information Governance Center, who will be examining the relationship between cannabis and mental health in First Nations. Over to you, folks.
Good day, everyone. My name is Alana Roscoe, and I'm a settler Canadian joining you today from Ottawa, traditional unceded Algonquin Anishinaabe territory. I'm here on behalf of the First Nations Information Governance Center, or FNIGC, to tell you about our research project titled Examining the Relationship Between Cannabis and Mental Wellness in First Nations, and its ongoing research process. FNIGC is Canada's leading source of information about First Nations people living on reserve and in northern communities, and is committed to improving the health and well-being of First Nations people. As a national organization governed by a regionally representative board of directors, we work mainly with our national and regional partners. In turn, our regional partners, with expertise in the distinct customs, circumstances, and needs in their respective areas, work directly with First Nations communities. As you can see here, our overarching vision and mission involves supporting First Nations in achieving data sovereignty, which may vary with each nation's distinct worldview, but essentially means the right to determine how data from or about First Nations is collected, accessed, interpreted, managed, and disseminated. Within this mandate, we also do research activities, such as this research project and the national survey from which its quantitative data is generated. This is a 2-year project funded by the Mental Health Commission of Canada, led by FNIGC and supported by AFN as a project partner. Its goals are to address knowledge gaps in the relationship between cannabis and mental wellness among First Nations adults and youth living on reserve and in northern communities across Canada, in order to inform policies and programs for the benefit of communities. The project kicked off in October 2020 and will wrap up in September 2022. The research involves a mixed method approach that includes a literature review, a quantitative component with a regional health survey or RHS data, and a qualitative component. The findings from all these data sources will be integrated in the report to be finalized this fall. The project aims to bring a holistic, culturally grounded, and balanced representation of First Nations data and knowledge to support the development of culturally relevant programs and tools to benefit mental health and wellness in First Nations communities in Canada, and to provide a solid foundation for future research. The project's advisory group incorporates a diversity of perspectives from First Nations knowledge holders and subject matter experts, including those with community leadership, community health, academic, and/or lived experience, and they vary in age and region. We've involved the advisory group in the project in 3 main ways. First, they've guided the development of research questions, selection of quantitative analysis themes and indicators, and qualitative data collection format to ensure relevance and utility to First Nations leadership and communities. Second, through qualitative engagements, members provided insights and context to the data analysis to complement and provide a story for the numbers that is rooted in community knowledge and lived experience. And lastly, we try to reciprocate in knowledge exchange through training and presentations to the advisory group and to AFN staff and committee members, aimed at making project findings accessible to participants and to build capacity in assessing and evaluating data and research in the future. Capacity building activities include training on First Nations data sovereignty principles, i.e. OCAP principles, and data literacy. These are the 3 overarching research questions co-developed with the advisory group. Though the project focus is on cannabis and mental wellness, the group advised using a holistic, strengths-based approach that recognizes the interconnection of mental wellness with spiritual, emotional, cultural, physical, social determinant, and historical factors. So these elements are incorporated in the research questions and analysis. The group also expressed a strong interest in exploring the motivations for and impacts of cannabis use. And while the quantitative data can address the first 2 research questions, it is very limited in exploring cause and effect. So we will rely heavily on the qualitative engagements for the 3rd question. The quantitative data, or the numbers, are drawn from the adult and youth components of the Regional Health Survey Phase 3, with data collected in 2015 to 2016. The RHS is the only First Nations governed national health survey in Canada that collects information on the health and well-being of on-reserve and northern First Nations communities. The RHS includes indicators on health and social determinants of health, and its questionnaires are generally self-administered by respondents on a laptop with a field worker nearby to help if needed. Just over 250 communities and their members, about 23,100 of them, were randomly sampled to make sure results are nationally representative. It's important to note that the RHS is a cross-sectional survey, a snapshot in time when people answered questions about their cannabis use and health factors, so it can't tell us about causation. The advisory group helped us select the indicators for quantitative analysis that they felt were most relevant to mental wellness and cannabis use in First Nations. These fell under 5 main themes as listed here. We looked at the association between each indicator and cannabis use, with some broken down by age group and/or sex. The adult survey had a question on whether cannabis use was for medical purposes, so we were able to look at associations with self-labeled medical cannabis use for this group as well. In order to make sense of the data and tell the story behind the numbers, the qualitative component aims to gather perspectives and culturally relevant contextual information on the quantitative findings to complement and enhance their interpretation and ensure that the analysis findings appropriately reflect the data needs and lived experiences of First Nations peoples. Qualitative engagements consisted of two parts: sharing the preliminary data findings and a guided discussion of these findings. In late 2021, we presented the preliminary data findings back to the advisory group, along with a data literacy workshop to support understanding of the data, before scheduling engagement sessions with them individually or in pairs according to their preference. We also coordinate a group engagement session with the AFN Mental Wellness Committee. Another goal of the engagements was to get recommendations on knowledge translation activities for the project findings. Participants shared their feedback on the most important findings, the audiences they should be shared with, and how they should be shared in order to maximize benefits to First Nations communities. So at this point, the data collection is done, and some portions of the report have been drafted, but there's still much work to do between now and the project's end date this fall. The qualitative data will need to be analyzed, and the data analyses are being revised, where possible, according to feedback received during the engagements. The data from both methods will be synthesized, then we can move on to writing, review, and finalization of the report. We're seeing some really interesting and valuable qualitative and quantitative findings, but the process hasn't been without its challenges. With advisory group members and AFN committee members, it's always tricky to find times everyone's available to schedule group meetings, especially so with the pandemic and other difficult events of the past year. Our team has also found it challenging to figure out the right balance of providing participants with enough information to support their informed guidance, giving them enough time to share their input, and keeping the time and effort burden low enough to work with everyone's availability. The RHS survey data can tell us a lot, but as a snapshot in time, when it tells us that cannabis use and poor mental wellness outcomes are associated, we don't know which came first. As with any self-reported survey, its responses can reflect a bias when respondents sacrifice accuracy in favor of seeming more socially acceptable, even when they are assured that their responses are anonymous. Closely related to this is the fact that the data was collected before cannabis legalization in 2018. Our engagement participants noted that social stigma surrounding cannabis use is slowly decreasing, but was stronger in 2015. So they advised that the prevalence of cannabis use, about 30% of adults and 27% of youth, may be underreported. Another thing that was mentioned by nearly all participants is the need for more research at the regional and community levels, as the challenges, opportunities, and cultural beliefs surrounding cannabis are different in every community. This project and FNIGC's mandate are at the national level, so future projects would have to involve our regional partners to address this recommendation. Finally, qualitative engagements explored recommendations for sharing the key project findings, but the time and funding needed to implement many of these are beyond this project's scope. We hope to address these in future work. We thank the Mental Health Commission of Canada for the funding and support and for inviting us here today, the Community-Based Research Canada experts who shared their lessons and advice, and we thank you for your time and interest in this project. If you have any questions that aren't addressed today, here's how you can contact us for more information. Thank you.
Thank you so much, Alana and Magnolia, for the great presentation. We now have some time for some question and answer periods. So we would like to say, if you would like to have any questions, just send it in the Q&A section for us to address it. Juste un rappel, vous pouvez aussi envoyer vos questions en français et on va les lire.
As a reminder, you can send also your questions in French.
If it's not possible we answer the questions right now, we will get to it at some point, or you can contact the research team directly. But as of now, maybe while we wait for some more questions, could you maybe speak to us on some challenges that you faced with COVID in doing research?
Hi, Connor. Thanks for your question. Yes, as some of you may be aware, safety and health within First Nations communities is understandably a priority over the last couple of years. So, a lot of time and energy and resources have gone towards that. And I mean, we've heard it's certainly, of interest and a priority to look at cannabis and mental wellness issues as well. But, there's more pressing topics at hand. So we did find that availability of people, just finding them to join our advisory group. It was a little difficult to find people who had the capacity, had the bandwidth for that. And even when we did find people, there was still limits in their availability. And certainly over time, different things have been happening in different communities. And we've just had to learn to be flexible and understanding, and just trying to keep the lines of communications open.
Thank you. And I'm just seeing that a few people are just asking about the presentation and the PowerPoints and things like that. So it is in the chat, but we will, I just wanted to remind you that we will be posting the French and English recording of the webinar on the website, and you can directly reach out to the research teams for the slides and for any other information. So while we wait again for some questions, feel free to drop them in the Q&A section. I was just wondering, why did you embark in this work? What really feeds that for you?
Great question. Specifically, and especially at the time, mental health, mental wellness was one of the research priorities at FNIGC. And those priorities were informed by, research work that had been done among our regional partners, and they in turn liaise with communities. So we were pretty confident that it is among the top research priorities of First Nations communities in Canada. Now, of course, at the time that priority scan was done, that was pre-COVID. And I think even when the proposal was submitted, we didn't quite realize how much of another priority COVID would be. We engaged with the Assembly of First Nations right from the start to kind of gauge their interests in being involved in this project. And we did hear from our partners there in the Mental Wellness Committee that it is a priority in communities as well. And specifically, AFN has been interested. It's one of their resolutions to add medical cannabis to the NIHB formulary in order to make it more accessible and affordable for First Nations health needs. So that is something that we have been keeping in mind throughout the project. I think at this stage, it's still pretty exploratory. There's a lot more research to be done, but it's a really great start, building block for future research.
Amazing. Thank you so much for that answer. We just got a question. So is there a plan to collect a new round of RHS data?
Yes, absolutely. Actually, at this point, the RHS Phase 4 survey has been developed, and I believe it's even being programmed. I believe it was, ideally, they were hoping collection would have started by now. It is a 5-year cycle generally. So RHS 3 was collected in 2015, 2016. So ideally we would have had the RHS 4 out in the field already. But, understandably plans have been pushed back due to the pandemic and all kinds of work being done, trying to reinvent the collection process in order to make it meet the safety needs within communities. And I haven't seen the final draft of the RHS 4 yet, but I do know that there was some more consideration in looking at the cannabis questions in light of, first of all, in light of it being legalized, and then also, developments that have happened in those past few years in terms of methods of using cannabis or ingesting cannabis, and maybe questions about vaping or edibles. Now it is a broader health survey with all kinds of social determinants of health. Oh, sorry about that. Just acronyms, I'll try to keep that in mind about acronyms. Anyway, yeah, so we're limited, I guess, in how detailed we can get in any one topic, such as cannabis. Thanks.
And thank you. And we just have one final question for you. So is this separate from the RHS Wave 4 regional and national survey?
At present, yes. I mean, the quantitative data in this study comes from the RHS phase 3, but yeah, at this point we don't have any data yet from the RHS phase 4. But if we are able to do future research on the subject, it'll be a few years down the road before we have regional health survey phase 4 data that is available to include, but we would love to be able to include that data in future research.
Great, thank you. So next up, we will hear from Alex McLean presenting on behalf of the Manitoba Métis Federation and their project led by Julianne Sanguins entitled Unpacking Cannabis Use and Mental Health in Métis in Manitoba. Please take it away.
Hello, everyone. Thank you for the opportunity to speak to you today about what we believe is a very important project to our people. My name is Alex McLean. I'm a research assistant at Toba Métis Federation, and I'm working on this project entitled Unpacking Cannabis and Mental Health in Métis in Manitoba under the supervision of Dr. Julianne Sanguins. Firstly, we would like to pay our respects to the traditional stewards of this land and recognize that it is the traditional homeland of the Red River Métis and Treaty 1 territory. The work we do here at the MMF is to address the harms of the past to support strength and resilience today, and this project is a part of that work. For those of you who may not be familiar with the Red River Métis, this is a nice map that illustrates the geographic outlines of the traditional homeland of the Red River Métis. And I'm speaking to you today from Winnipeg, Manitoba, which is located in Treaty 1 territory. So jumping into the project, what we're looking to do is explore the experiences and perceptions of cannabis use within the Métis population as it relates to mental health since cannabis's legalization in 2018. Our project has 3 objectives. Firstly, we would like to broadly describe the use of cannabis within the Métis population and any associations with mental health. Secondly, we'd like to determine any changes that may have occurred within the Métis population since cannabis's legalization. And then finally, we'd like to employ knowledge translation and mobilization strategies to share the evidence that we learn from our insights into this project back to those in the communities to help them make more informed decisions in their own lives and to guide programming and policy that directly benefits Métis citizens. So to understand why we're investigating this topic, some background statistics might be useful. So currently in Manitoba, there is a higher rate of cannabis use than the national average. Almost 70% of Manitobans have reported trying cannabis by the age of 18. Over 5% of Manitobans use cannabis every day compared to just 1.8% of the rest of Canada. And on top of this, Manitoba has a higher prevalence of mental health concerns than does the national average. And the Métis population are overrepresented in both of these figures for cannabis use and mental health. So we feel it is very important to investigate this relationship and any possible associations between cannabis and mental health within the Métis community. So here are some data from previous studies we've conducted at the MMF. You can see on essentially all measures of healthcare and outcomes, the Métis population are worse off than the rest of Manitoba. So things like heart disease, diabetes, you can see significantly higher. The use of drugs to treat such conditions are significantly lower. And I think a very important statistic at the bottom here is Métis citizens are on average 21% more likely to die before the age of 75 than are the rest of Manitobans. And this trend is not just for physical health outcomes too, this is also for mental health as well. So this is some data from other studies we've conducted here at the MMF. You can see anxiety, depression, substance use, all of these factors are significantly higher in the Métis population, and this is prevalent across essentially all factors. So the methodology of our study involved guided discussion groups with Métis citizens. This was done at our annual health summit, which we hosted back in September. We had over 200 Métis citizens take part over the course of 2 days, and we allowed them to share their knowledge, answer questions, and give feedback on their personal experiences with cannabis and the effect on their communities since legalization. This could be both positive and negatives. So we have since transcribed these interviews and are in the process of analyzing the transcripts via our collective consensual data analytics process, which is the framework that we use to compile out our final report, which is the stage of the project that we're in currently. So here you can see some of the data and demographics from the Health Summit. Of the roughly 200 participants, we had 85 respondents. You can see the respondents did skew quite heavily female, but we had a very nice range of age groups. We were well represented from youth all the way to elders. And here you can see the proportion of citizens who reported using cannabis. It was 67%, which is in line with what we gathered from other research of about 70% of Manitobans having tried cannabis. So the results that we found from speaking with Métis citizens is that there's a lot of reported benefits to cannabis use, both from a medicinal perspective as well as socially. The most common cited benefit was for pain management. We know that on average, Métis citizens live with 2+ chronic conditions that often require pharmaceutical interventions. And the reported use of cannabis helps to alleviate some of this medical burden, both physically and mentally. You can see some statements here, for example, relief of migraines, nausea, aiding in anxiety and other life stressors, things like that. So these are very common reports that we're hearing. However, we also did find a fair bit of concerns reported with cannabis use, mostly associated with the overuse of cannabis, possibly leading to worsened mental health outcomes, especially with those who may already have a mental illness or be predisposed to them. And very concerningly, among use with those under the age of 18 in our youth, so those who are both developing physically and mentally. A lot of the concerns that we heard stemmed from a lack of consistent and reliable messaging about cannabis use. And something we heard over and over again from citizens is that they want us at the MMF to be involved in working with communities in navigating this new area of legal cannabis, which is kind of a gray area in the community at a moment. And they want us to work with them to develop programming and policy that works with both cannabis and mental health. So that is exactly what we hope to do in completing this project. Our results will have a lot of implications for us as an organization to develop programs and policies for our citizens. We'll be adding much needed information regarding cannabis use within the Métis population. And from what we are hearing, citizens value the potential benefits of cannabis use for a host of factors that I've mentioned previously, but they want to know for sure that they have a comprehensive understanding of its uses. And we believe that the results from this project will position us better to create programs for our citizens and inform policy that is meaningful to those we serve. So as I mentioned, our project will add specific insight into the cannabis use within the Métis population that's currently missing. We hope to incorporate some of this information into our current and future programs at the MMF. So what we're doing currently is we have a mental health support line. This is free of charge to all Métis citizens. We're hoping to be able to expand the service to be 24 hours as it's been such a great success. And on top of that, we're also in the process of establishing an addictions recovery center and mental health facility, which the information from this project and input from the community will aid in developing. So finally, just some things to think about, some goals that we hope this project will answer. Most importantly, has the legalization of cannabis been an overall positive or negative for the Métis community? It's well known that Métis citizens have worse health outcomes than does the rest of Manitoba and are often underrepresented in policy and programming. And this can definitely affect the way that cannabis is both used and perceived in the communities. So this is things that we'd like to answer. And with that, I'd just like to thank you all for your time. I'd like to acknowledge the support of the MMF, our cabinet and president, our sources of funding, and finally our Métis citizens who without their support, we wouldn't be able to undertake projects like this. So we really would like to thank them. And then finally, there is mine and Julianne's contact information. If anyone has any questions or concerns, of course, you can feel free to reach out to us. And with that, I'd just like to thank you for your time, and I will end it there. All right, thanks.
Wonderful. Thank you, Alex, for a great presentation. We now have some time for a question and answer period with our audience. So gentle reminder that for your questions to be addressed, please first type them into the Q&A box. Please feel free to ask in English or French. And it has been noted that there were, someone had mentioned there was some trouble hearing myself and the presenter. So I've plugged into my earphones. Please let me know if that's made a difference. All right, and so getting to some questions that have already been asked. There we are. Okay, so someone in the chat was mentioning this more so as a point of reflection, stating that with the overrepresentation of Indigenous inmates in Canada, perhaps considering the ways to explore the possibility of engaging with this population for results. So just wondering if there were any comments on that, either from you, Alex, or our previous presenter.
So engaging with the population in what perspective?
I'm not sure if the person who commented that expanded on that. So perhaps if they would like to expand on that in the chat. My sense is just engaging with inmate populations in general.
In terms, oh, so I was going to say, in terms of our population, we certainly, once we have a report, then we'll certainly be sharing it with all across our homeland or all across Manitoba, in terms of welcoming the thoughts that people have. And I just want to say that Alex, his screen is frozen and he has no audio, so I'll be responding as best I can to questions.
Okay, sounds good. Thank you. All right. So another one here is, did your research look at prescription versus non-prescription use of cannabis? Yeah, and please.
No, we didn't. We just looked at, we were just interested in looking at what has happened since cannabis became legalized. And part of that is because although there is prescription use of cannabis, it isn't covered by pharmacare in this province. So people may get a prescription and not fill it because they can't get reimbursed for it. But also because we were specifically looking at what had happened since it became legalized.
Thank you. Another question here. So Alex had spoken briefly about Métis and mental health concerns with regards to cannabis use. They're curious to know if there's been any research regarding cannabinoid, hyperemesis syndrome, or CHS.
Not in our population.
All right.
And another one here. Lots of questions rolling in. How are
That's
you?
a thing.
Yeah, it's a good thing. Yeah. How are you analyzing data that may include researcher bias or self-bias of the participants themselves?
Well, what we have is what's called a collective consensual data analytic process. So we call it CDAPing. And the person who's the lead person on the study kind of takes each bit of the transcript and gets a few keywords. And then we sit down as a team and we look at each of the keywords and we try to put it under symbols that aren't defined yet what they are. And at the end, when we go through all the transcripts and all the keywords have been placed, then we theme it. And so because we're using a consensual process and there's a group of people, we attempt to avoid bias. Now, sometimes when you're getting tired, you may not always agree, but you agree for the sake of moving on, but it works effectively for us and it's worked effectively in many projects.
Thank you. Another one here. So you're being thanked for sharing your findings. And there was a mention of quote unquote overuse leading to increased risks for young brains that are still developing, risks including schizophrenia, psychosis, etc. So how would you or your participants define overuse?
I think it's probably self-defined, but if you're using it so it impairs your daily functioning, so that when you come home from, for example, if you're a youth and when you come home from school or work, then you don't do what's needed around the house. So if you're a youth, you don't do your homework or you don't associate with your friends or whatever is on your agenda for that evening, then that would be considered overuse. Also to the point of being impaired when you drive or that kind of thing.
Right, yes. A lot of engagement with your presentation here. Someone asks, and I think you might have touched on this earlier, but were you able to capture the source of cannabis people used, for example, regulated versus unregulated?
We didn't ask that question.
Okay.
Although it's interesting because we do have a team that's with us and we have an elder and we have a person who's worked for a long time. She's Métis, but within the Métis population, and she's spoken many times about the different types.
Okay. And I'm just curious for myself, was there any reason in particular that question wasn't asked, or it just wasn't on the table?
It was, we only had a limited time, so we had to really gauge how much. Now, it was really interesting because one of the comments that did come up was, you know, it has to be good because it grows out of the earth. And I thought that was pretty profound that people could see that. Because we didn't want to approach this project in terms of, oh, it's bad to use cannabis. We just wanted to know broadly what changes they'd seen, and we asked if it caused people to be less engaged with their communities. You know, in terms of their use and if they felt alienated or whatever.
Absolutely. And so we do have a couple more questions coming in before we go on to the next presentation, but there will be more time in the end for questions that weren't addressed to be revisited. So someone asks, how can your research help with the TRC, or the Truth and Reconciliation Commission, calls to action? And what healing do you identify that can come from it?
Well, that's a loaded question. I think that our research is just one part of the puzzle. And for our people, it's just creating a space for the Métis voice to be heard. And it certainly doesn't represent all Métis. It represents the people that were at our health summit. So I think that in terms of making broad statements or broad and far-reaching things, that we would need to do a more focused campaign. And it all depends on research funding.
All right. Thank you so much, Julianne, and also Alex, for your time here. So at this point, I have my eye on the time, so I think we should move on to the next presentation. And like I said, we'll be able to address what was missed in the questions later on. Thank you so much.
Thank you.
All right, thank you, everyone. Next up is the third presentation, some familiar faces for me. So Kristy and Sacha Bragg from Thunderbird Partnership Foundation, who will be addressing the stigmas of parental cannabis in use in First Nation communities through community engagement and policy review. So I'll pass it on to you.
Hi everyone, my name is Kristy Kowatch and I'm from Lakehead University. I'm here to talk to you about a project that I'm doing in collaboration with Thunderbird Partnership Foundation that's looking to address the stigma of parental cannabis use in First Nations communities through community engagement and policy review.
Thanks, Kristy. My name is Sacha Bragg, and I'm part of the research team at Thunderbird Partnership Foundation. I come from Munsee, Delaware Nation, but I'm currently coming to you from the City of London, which is on the traditional territory of the Haudenosaunee, Anishinaabe, and Lenape people. And I'll pass it back over to you, Kristy.
Awesome. So this project was developed based on a conversation between Kara Hopkins, who's the director of Thunderbird Partnership Foundation, and community-based service providers, but identified that there's a wide variety in policies regarding parental cannabis use, child apprehension, and parental monitoring when cannabis use has been identified. So through this project, we're hoping to identify what types of parental cannabis use patterns lead to child apprehension, how or if policies have been influenced by the recent legalization of marijuana, and if these policies are working from a harm reduction perspective. One question that we will be addressing is if these policies align with knowledge within the existing literature regarding parental cannabis use and child outcomes. And this perspective is based on the knowledge that placing children into child welfare can be a stressful and even traumatic event sometimes. So we're going to be working to translate this information to a First Nations perspective through community engagement and working groups with stakeholders, which Sacha will talk a bit more about. And these sources of information will be integrated into the development of toolkits for community and organization use. The first step in the process of developing these deliverables is to gather a whole bunch of information. And one source of information is a literature review that we've conducted. We searched a whole bunch of academic and grade literature for articles, and we had over 50,000 articles or publications be returned, which we whittled down to 34 articles to be included in the review. These publications identified that there were a few areas that needed to be taken into consideration in the development of our toolkits. So the association between parental cannabis use and later child cannabis use has shown some mixed results. And some studies have identified that there are increased risks for children when one parent, specifically mothers, use cannabis, but fathers do not. A few studies have identified that parental cannabis use is associated with earlier use and increased risk for disordered use of cannabis in children. However, some studies considered parenting factors as a moderator of this relationship, and they found that when they considered parenting behaviors, that relationship was no longer statistically significant. Children are also more likely to use earlier and more frequently when their parent meets criteria for disordered cannabis use. However, some studies have found that there's no difference in cannabis use between parents who use cannabis but don't meet criteria for having a disorder and those who don't use cannabis at all. So the level of parent use really influences later child use and child risk for use. So the association between parental cannabis use and adverse child outcomes is influenced by a number of factors as well. Parents' ability to control their emotions is related to this. So when parents have a hard time controlling their emotions, children are more likely to use cannabis. And there's also a cyclical relationship between parental cannabis use and problems with children's behavior being associated with more cannabis use by the parent later on. So when kids are having difficulties with their behavior, parents are often using more cannabis. Also, the level of parental involvement in childcare and monitoring has been related to child outcomes. So parents with lower involvement when they're using cannabis is related to greater risks of kids using cannabis later on. And children's involvement in risky situations during adolescence through their peer relationships, exposure to cannabis and other substances, and perceived parental approval of cannabis or substance use is associated with increased cannabis use for kids. And cannabis use is associated with lower sensitivity, harsher parenting, and more aggression among parents. And these tendencies were found to be associated with emotional dysregulation. So again, having difficulties controlling those emotions, and the use of other substances among parents, including alcohol, tobacco, and opioids. Parental cannabis use may not always impair parenting behaviors though. Hill and colleagues found that parents who used cannabis but did not meet criteria for a disorder had similar levels of positive parenting to non-users, and their children had similarly reduced risks of engaging in cannabis use. And having specific cannabis rules can contribute to lower adolescent cannabis use regardless of the level of parent use of cannabis. Based on these initial findings, it seems that when parents meet criteria for cannabis use disorder, their children are more likely to experience greater risks for later use, which is likely influenced by parents' emotional regulation and parenting practices. However, it should be noted that within the articles that we included in this review, there is a wide range of definitions of cannabis use, and that will be clarified in the report that we developed from this review. Going forward, we are looking to broaden our knowledge about this field by including a few additional reviews. And those reviews include looking at how child apprehension influences child outcomes. So again, looking to see if that's a stressful and traumatic event for kids, and when it is and when it isn't, looking at prenatal exposure to cannabis and what child outcomes that's associated with, and then looking to see how child outcomes with cannabis use, parental cannabis use, is the same or different to other substances like opioids and stimulants, again, situated in that harm reduction perspective. So I'm going to hand it over to Sacha to talk a bit more about our working group.
Awesome, thanks, Kristy. Okay, so when we sat down to, I guess, create the working group, we were looking for participants from First Nations across Canada that bring community, cultural, legal, child welfare, and clinical knowledge that will drive the direction of the research. So the working group will provide information about existing practices surrounding cannabis use and child protection policies within organizations, as well as information about community needs. So we're trying to secure representation from all geographical areas within Canada. So we have contacted 25 people to participate. We've confirmed 14 participants for the working group so far, with the participation of 3 elders and traditional knowledge keepers. So participation of these elders and knowledge keepers will ensure cultural protocols will be followed when Indigenous knowledge is shared and disseminated. A consistent priority will be to honor Indigenous evidence that is often outside the scope of conventional evidence, and thereby demonstrate a cultural foundation. And we're hoping that with having 3 elders involved, that will ensure that there'll be an elder present at every meeting. So also by inviting people to participate in the working group, we're building new relationships, which creates an opportunity to engage diverse perspectives about harm reduction, law and social welfare, and treatment approaches that can be utilized in First Nations communities. Next slide, please. So all materials created will be presented to the working group and First Nations communities to be validated through discussions in the community. So the synthesized information from the working group will be used to develop plain language prevention, early intervention, and harm reduction products, such as posters, pamphlets, and videos. So these products will emphasize the outcomes of parental cannabis use for children and how parents and/or community members can reduce the negative impacts these behaviors might have. So providing these messages in an accessible format will support Thunderbird Partnership Foundation's initiative to deliver services in a culturally competent and quality way. And just, we finally finalized our first working group meeting. So we're really looking forward to taking part in that.
If you should have any further questions, please do not hesitate to contact us by email at research@thunderbirdpf.org.
Thank you so much. And I'm so sorry for everyone that couldn't access the French slides. We're just having some technical difficulties, but we are trying to resolve it. So thank you so much for those of you that have been so patient with that. And thank you to both of you for the presentation. It was so informative, and we have a few questions that came in the chat while both of you are talking. So the first question is there any interest in researching children and cannabis for medical reasons such as seizures?
I can speak to that. So that is far beyond the scope of our project. I think that is something that a lot of people are very interested in. And I know a lot of families who have kids that experience seizures are pretty excited about the potential utility of cannabis. I'm not sure where the literature stands as far as like safety in terms of the use of cannabis. But I know that there are some researchers out there. I'm not sure exactly which researchers, but there is some interest in pursuing that because I know that that is an area of interest, especially for parents of kids with seizures.
Thank you. And we have a second question. So when will the report for this presentation be prepared to accompany the presentation?
We are currently putting the final touches on it. So I don't have an exact date of when it will be finished. It is coming to the end of being completed. So hopefully within the next few months that will be available, and it will be available through Thunderbird Partnership Foundation. And I believe you can contact research@thunderbird.org. But Sacha can clarify that if I got it wrong.
It's research@thunderbirdpf.org. Yeah.
Thank you. And I just have a question out of curiosity for the both of you. So how important is it to you to have an Indigenous lens when doing research, keeping in mind the context of research in Indigenous communities?
That's a good one, Connor. I think it's very important, to have that understanding of the experience of Indigenous people. Researchers need to have that, I think. So I think it's very important.
Like everything that Thunderbird produces, culture is the foundation of everything. And so that really guides how we approach all of the different projects, and addressing those community needs in everything that's produced from any of the research projects is one of those key priorities that we have. Yeah, so very important.
Thank you. And I know doing research of my own in Indigenous communities can be a little difficult. So I was wondering if you had any challenges when it came to accessing that research, that data, and really getting into those communities to learn that information.
So with this project, we haven't gotten to that point yet. That's in the future. Yeah. So
And one of the reasons is it's really important when working with Indigenous populations that you're taking the time to establish relationship, because everything's based in relationship and understanding the intent of the research and making sure that those needs are clarified before providing the information to make sure that there is that safety in that relationship. So we're taking our time to build up that relationship with our working group before we're asking for any kind of information. And that process is underway, and excited about our first working group meeting on Friday. So yay.
That's very exciting, and I'm so excited for you guys to be able to have that information. So just one last question. Why do you feel that this research is important, and why should this be studied, and why should people care about this research and really put in the time to learn it?
Because there isn't information on the impacts on Indigenous communities. So making sure that this is out there, because legalization is still new. And so child welfare policies haven't been adjusted. And we also know that unfortunately Indigenous children are apprehended at a higher rate than non-Indigenous children. So yeah, this work is so important. So yeah.
Thank you. And if anyone else has any questions, we will have that question period at the end. But I would like to thank both of you, and it's so nice to see you both again. Oh, I just got another question, so I'll be able to ask that. So is there an opportunity for additional First Nation communities to participate in the working groups?
Absolutely. Just get in contact with us through that email that we mentioned earlier. Sacha can throw it into the chat box. But yeah, we'd love to have more people in our working group if that's something that you're interested in. And anybody who might have like lived experience, would absolutely love to hear from people like that. Yeah, so if you're interested, just drop us a line.
Amazing. Thank you so much. And I'll pass it back to Uba.
Thanks, Connor. So please note that due to unforeseen circumstances, our fourth presenters, Terry Gillis and Julianne Jones from the Métis Nation, British Columbia, are unable to attend today. So we'll be moving to our final presentation at this time. Our final presentation is by Doctors Lindsay Farrell and Zach Walsh from the University of British Columbia. Please take it away.
Hi, everyone. Thank you so much for joining for our webinar on cannabis use among Indigenous peoples of Turtle Island, motives for use, substitution, and impacts of legalization project. Julianne, Lindsay from Indigenous cause. Hi, everyone. Good morning. It's really lovely to meet you and greet you in my language. My name is Lindsay Farrell. I am an Anishinaabe, a member of Edmonton First Nation, and I grew up in Thunder Bay. My dad is a white settler of English, Irish, and Scottish descent. Today, I'm just looking outside. It is a beautiful blue sky and cloudy on the unceded homelands of Musqueam, Squamish, and Siletus. And it is with utmost gratitude that I give thanks to the sovereign nations of these territories for allowing me to reside on their traditional lands and do this research, which is just such incredibly important within the cannabis industry. Now I'll pass to Zach for his introduction.
Hello, my name is Zach Walsh. I'm a professor of psychology at UBC in the Okanagan campus. I'm coming to you from my home on the unceded territory of Silk Okanagan Nation Alliance. I'm a cannabis researcher of settler ancestry. Been working on medical cannabis and related topics for a number of years, and I'm really pleased to be able to share this presentation with Dr. Farrell.
Thank you, Zach. I just wanted to spend a few minutes just speaking about how Zach and I, as the co-principal applicants in this work, are situating ourselves. Historically, Cannabis research has largely been informed by solely a Western lens, with data collected from European descended sociopolitical majority in what is currently known as Canada. So Indigenous perspectives and our lens on this work has really been missing. And in this work, we're really proud to have prioritized Indigenous voices and to have a predominantly self-identified Indigenous project and research team. What makes our work really different and unique within this field is that we do have a specific focus on Indigenous peoples, with our interviews being conducted by, again, self-identified research assistants. So our project overview, the short name of our study is Cannabis Use on Turtle Island, also known as a CUTI study, which I'm in love with this name. It's very easy to say, but the cannabis use among Indigenous peoples of Turtle Island, we're really looking at motives for use, substitution, and impacts of legalization, bringing together cannabis use researchers, Indigenous health researchers, and most importantly, representatives from Indigenous communities and health organizations to really just learn more about the impacts of cannabis use and the regulations on the health and wellness of Indigenous peoples. And again, just a very specific focus on the therapeutic motives for use and local access. I'll pass to Zach to just spend a little bit of time describing in more detail our partnership activity.
Thank you. Our partners in this project are Woodland Cree First Nation and Indigenous Bloom. And Woodland Cree First Nation are involved with Indigenous Bloom. Indigenous Bloom is a collective, a cooperative of First Nation and Indigenous people who are developing partnerships to ensure participation of First Nation and Indigenous communities in the medical cannabis economy. And what they do is produce and distribute cannabis on First Nations and Indigenous land. And amongst the community, there's a number of communities from across British Columbia and Alberta and other parts of Canada that are members of Indigenous Bloom, and Woodland Cree First Nations is one of those, and take a leadership role in Indigenous Bloom. The partnership involves first of all, making sure that we have those perspectives when designing the research, so that the research questions are informed by the community that they're intended to serve. Also, a really valuable way for us to be able to connect with the communities of interest. So because Indigenous Bloom locations are on in First Nations communities, we're able to get help with recruitment from those locations. And that gives us a bunch of different locations that we're able to recruit respondents from. But we also want to look broadly, but more specifically. So with Woodland Cree as one specific community, where we're doing more of a deep dive and getting a broad response from the community, from cannabis using and non-cannabis using respondents. Whereas with Indigenous Bloom, we'll recruit primarily people because they're purchasing cannabis at Indigenous Bloom locations. They're going to be primarily cannabis users. So we get a broad scope of respondents and also a specific look at a unique community. And the questions we're asking are looking at motives for cannabis use among Indigenous peoples. As Dr. Farrell said, the overwhelming majority of research on cannabis use, particularly therapeutic use, has been focused on settler communities. And really it was noted even in the Senate review of the cannabis legalization bill that there had been inadequate consultation with First Nations. So it's important that we've accessed those communities to find out, how are they using cannabis? What are the motives? What are the risks? And what are the potential benefits of medicinal use? Within that, we're very interested in how it affects the use of other medications, and particularly substitution for opioids. That's been a research interest of our group. We know the devastating impact of the opioid crisis across Canada, in all communities. And so we want to see what's the potential of cannabis as a potential substitute. Also want to see how legalization is rolling out, part of this funding opportunity, and more broadly looking at the review of the Cannabis Act. We want to make sure that there's all voices represented at the table. And beyond looking within Indigenous communities broadly, we also want to see whether there are differences according to age, gender, residence on and off reservation, and other factors. Back to you, Dr. Farrell.
Thank you, Dr. Walsh. I'll just add one last a point that specifically during the COVID-19 ongoing pandemic, really just the importance of these research questions being approached from an Indigenous perspective in order to support self-determinism and the health and wellness of Indigenous peoples, and also inform public health programming. So really valuable. Kowatch, thank you so much, everyone, for joining our time today. If there's any questions, please don't hesitate to reach out. I've included the emails for Dr. Walsh and myself. Wishing you a wonderful rest of the webinar series. I'm sure it's going to be wonderful. And look forward to hearing from you soon.
Yes, thank you so much. And we're looking forward to coming back with some results soon. We're in the middle of doing the interviews and things are going great. So we'll look forward to next time we can catch up and tell you what we found.
Thank you so much, Dr. Farrell and Dr. Walsh, for a great presentation. I'm really excited on any follow-up on your research. And so now we have some time for questions at an answer period with our audience. As mentioned, please feel free to put it in the chat, either in English or French. And so we do already have a few questions here. Someone's curious to know if you have any preliminary findings regarding cannabis as a substitution for opioids.
Yeah, well, thanks again for having us on the webinar series. Unfortunately, Dr. Farrell has had other engagements this morning, so wasn't able to make it, but I'll do my best to answer the questions as best I can. We've completed about 25 interviews so far. We haven't had a chance to look at to even do preliminary analyses of the data yet. We're aiming to have a couple hundred. So it's rolling along nicely. We've done all the preliminaries, and now the interviews are rolling in. But we don't have preliminary data yet. It's been an area of research interest of mine for some time, and we do know broadly that there is a lot of self-reported substitution of cannabis for opioids, and we've also seen, in some cohort studies, people reporting reduced opioid use, as well as those cross-sectional studies. But this hasn't particularly examined Indigenous communities, which is why we're so excited to be able to broaden our lens.
Thank you, Dr. Walsh. Someone notes that your team uses Indigenous peoples and First Nations interchangeably. So is this to include Métis and Inuit populations as well?
Yes, self-identified Métis and Inuit are also eligible to participate in the interviews, although the partnerships are particularly with the First Nations community of Woodland Cree. But through our recruitment at the Indigenous Bloom locations, we hope to also recruit Métis and Inuit.
All right, and as we wait for more questions to roll in, I'm wondering if you had anything to say regarding, the stigma, the disproportionate, first of all, the disproportionate discrimination that happens in our country towards Indigenous people, and the stigmas associated with cannabis use, and sort of where that intersects for Indigenous folks. Just any thoughts around that?
Yeah, no, that's a great observation, and something that we're looking at tapping into with some of the interviews, because certainly there's that perception, and that's something that we've encountered, but we haven't formally been able to document that double sense of stigma, both within communities and between communities and law enforcement at times, et cetera. So some of the questions that we asked, particularly because we're focused on medical use, is about physician communication. Have felt discriminated against by your physician? Is this something that you feel comfortable speaking with medical providers about? And if not, have you spoken with it? If not, why? Have you asked questions? It's something that I think as we look at the reemergence of cannabis as a legitimate medicine, which it has been, for thousands of years across different parts of the world. Something I always like to focus on is this prohibition is really the abnormal piece of humans' association with cannabis. This is, people say legalization is an experiment, but I would say that criminalization was the experiment and it was a failure. So we got the results there, but now I think as we try to reintegrate this medicine and see how is it used, how can it be perhaps a harm reduction in terms of some other medicines that have more dire side effects? How is stigma a particular barrier? Is a big part of our motivation for this research.
That was so wonderfly said, and really appreciate your thoughts around that, as I think it goes beyond the conversation of, what is right, what's not, what's criminal, what's legal. And so it's so exciting to hear that you and Dr. Farrell are part of this research with coming from this framework. So thank you so much for that. Just taking a look here if there are any more questions. All right, it looks like those are the questions that we have for now. Again, thank you so much.
Thank you so much.
Wonderful. And so this does conclude our question and answer period. We would like to address any questions that were not mentioned earlier. And so this was for, sorry, just kind of finding myself here.
Ooh, I saw you got another question, so I'm back.
Oh, okay, great. Please go ahead.
Yeah, asking about whether we ask about harms. Certainly we make a venue to ask about harms. If there's any negative consequences that people feel in using cannabis. How we ask pretty open questions about how it compares to some other medications that they may be using. We ask about what are some barriers to using cannabis. But quite frankly, I think there's been a huge overemphasis in cannabis research on harms, and so I feel that that's something that we really want to look at. But there's also there's been a lot of people that have been looking at the harms of cannabis use almost exclusively within the medical framework. So I feel confident that work on harms, as much as we want to leave that open and provide a balanced view, I feel like there's a lot of people carrying that burden of examining the harms of cannabis use, and I'm not concerned that they'll go unnoticed.
Thank you so much. Connor, just wondering if you wanted to jump in here.
Yeah, of course. So thank you so much for the specific questions. Now we're just going to move on to more general questions. There was a question that was posed to the Manitoba Métis Federation, but we also are wondering if this would apply to any other teams. So curious to hear from all teams about whether or not they asked people about the source of cannabis, so regulated versus unregulated. So if anybody from any of the research teams would like to jump in on that, feel free. And again, just a reminder that if you have any questions for any of the groups, please feel free to add that in the Q&A right now.
So sorry, I didn't get the first part of the question. I got the regulated versus unregulated.
Yeah, of course. So someone was just curious about whether or not they asked people about the source of cannabis, so regulated versus unregulated.
No, we didn't, because we were specifically looking at what's changed since cannabis became legalized. However, the elder on our team and somebody else on our team said that people who had always been using cannabis before it became legalized still went to the same people that they bought it from, because stores weren't necessarily easily accessible to them. So I guess you could say that that's unlegalized cannabis.
Okay, thank you. And if there's any other group that would like to maybe add to that, feel free.
Yeah, I can speak to that a little bit. We are asking those questions of our participants. It's an area that we're quite interested in, because we want, in terms of access and in terms of medical use, it can be quite important to have easy access. access can be a barrier to effective use. And also, if it's going to be most helpful, we want to make sure that it's being delivered in a way that facilitates effective use. That means reliable labeling. It means adequate pricing, and also looking at barriers to people providing their own. And in some communities that are maybe not well served by dispensaries or official cannabis retail, how are those communities making sure that they do have equitable access, and whether that involves self-production. I think one of the areas of interest, particularly for our partners at Indigenous Bloom, is how is it possible for communities to produce their own, and how does that impact the well-being of the community if they're able to have economic opportunities that can come with that, instead of the money leaving the community and going to producers outside of the community. So how does self-production play into that? How does that lead into, and I think it feeds back to the other question about stigma. If something's being produced within the community, by the community, for the community, I think that's an important thing to consider when we look at stigma and how the medicine is part of a bigger picture of wellness within the community. So we are asking about those issues.
Thank you so much. I think it's very insightful to talk about all the different medicines and things like that, and how it can have an impact in communities, and how it can be different in communities, whereas in Western communities. I'll just pass it on to Alana now.
Hi, thank you. To answer that question, in our quantitative data in the Regional Health Survey, short answer is no, we don't have that kind of data in the survey. But I'm glad you asked, because it was an interesting question that came up a few times in the qualitative engagements. Now that qualitative data is also being analyzed, but I can say that that it came up in the sense that now that it's legalized, there are more there's more labeling. It was mentioned by participants that the amounts of THC, the strength and the amounts of CBD and the balance of each can have a great impact on the mental health outcomes and medicinal applications. And as well, that question that I think Dr. Walsh just mentioned, the question of jurisdiction and Indigenous owned and operated sources also came up. So it is something that will be touched on, and definitely something that's been flagged for a future research priority.
Thank you so much, Alana. And so we did want to bring back this question of the importance of the Indigenous lens in this amazing research all of you are doing. So this is opened up to all of the presenters. As someone who does come from a number of groups that are considered visible minorities or that are systemically discriminated against, it's such a pleasure to be hearing the passion and the joy surrounding the research that all of you are doing. And so, yeah, just wanted to put that out there again. If anyone has further comments on, for them, what's important about the Indigenous lens in regards to the research that you're doing. And I invite any presenter to jump in. Yes, Alana, please go ahead.
Hi there. So I think the Thunderbird Partnership Foundation presenters had a really good answer on that one. So I would echo what they said, but also, even though the Regional Health Survey where we're getting the quantitative data from, even though it was developed by and for First Nations, numbers can only tell us so much. And, previously we would do research reports where they would be very quantitative focused, and we would get some feedback about, maybe areas that were kind of missed or not quite interpreted from a cultural lens. So we started adding in qualitative components into all of our research projects. And that has improved the quality of the findings and, you know, the discourse in the research studies immensely, because we've been taking the quantitative findings and bringing them back to people. And of course, you know, a cultural lens is very important, but also in any research, just having a lens input from people with lived experience. So we've had so many instances where we present a finding and we get all kinds of interpretations or explanations or questions or suggestions that we just never would have thought of otherwise. And we were also very fortunate to have an advisory group involved in the research design from the beginning. You know, we had a research on mental health, mental wellness, and it was that group that pointed out, you know, from a cultural lens, it absolutely has to be holistic, and that really helped us add in several other indicators, and particularly, you know, from cultural language and also historical experiences and trauma. So yeah, absolutely important. You're only getting part of the picture. You're getting a misleading picture without that lens.
Absolutely. Thank you, Alana. That is so important, and so glad that that's a part, like, that's woven into all of your research. And there is a question here for our friends at UBC. In your research, are you considering the question that cannabis use can be negative or detrimental?
Oh, I think I replied to that one at the end of the last round, but I can speak to the Indigenous lens a little bit as a settler researcher, and unfortunately the Indigenous researchers that are the bulk of our team are not able to be here, but we certainly consulted with the communities, the health office at Woodland Cree First Nation at the very beginning to see what their interests were and what areas they'd like us to focus on in the interviews. And we have a predominantly Indigenous-led research team. And a really exciting part of that for us is that there's a team of 3 graduate students of Indigenous scholars who are leading the research and conducting all the interviews, so that it's that I think that really embeds the research in that context, and I think that that's so important. And also, you know, research is always a great training opportunity, or can be a great training opportunity. So hopefully we're developing the next generation of Indigenous cannabis researchers, and I look forward to a time when it can be an exclusively Indigenous team, perhaps, and I can step aside.
Thank you so much for that, and apologies for the repeated question there. And so this does conclude our question and answer period. To our wonderful attendees, please know that you can reach out to the researchers with further questions directly, and perhaps if the teams can add their email addresses once more to the chat, that would be great. So a sincere thanks again to our presenters for sharing your time and expertise with us today. On behalf of CCSA and MHCC, we would like to thank everyone who participated in this webinar, which, by the way, has officially kicked off our Cannabis webinar series winter edition.
Yes, and this webinar and the research it presented have helped close key research gaps in cannabis and mental health, First Nation, Métis, and Métis communities in Canada. So, miigwech kinawea, merci tout le monde. Thank you everyone for attending.